I want to say sorry for the video not already being on Blackboard, but I have had some technical difficulties. Usually whenever we're doing these things, um, my programs work because I'm on my Mac, but since I'm not at home, I'm staying at my mom's, we are having all kinds of technical difficulties. It's been a little bit crazy, but hopefully I figured out this PowerPoint thing. It's only been like 20 years since I've learned PowerPoint and how to use it, so hopefully it's going to work and we're going to be able to get all of this taken care of. Now, you might hear stuff in the background because mom's here, my son's here. I'm not just in my office, so um, if I like a dog and I catch a squirrel, then that's just because, you know, my attention is going elsewhere. But really quick, I wanted to, before I started this, a lot of people wanted to make sure you guys knew that your Flipgrids are mandatory. I don't know where to look. Okay. So your Flipgrids are mandatory, and I have had a couple of people go in there on your Flipgrid 1, and I believe there was only 6 of you that uploaded your videos to work on your AIDIT. However, on your Flipgrid 2, you were supposed to go in and practice with your tube colors, show me the tube color, tell me the department, tell me the additive, and you were supposed to record that nightly. The reason why I wanted you guys to do it nightly was because the more practice you get, then the easier it is to learn. Repetition is key. So only 4 people did recordings on that. Now, not everybody did at least 5 like I had suggested. The most I believe was like 2 or 3. However, I do want you guys practicing every night. That is a source that we can use to stick together and practice together, and would be, it's really beneficial to your future. So if you're not going to do that, then I can't help you. Whenever you're testing, I'm not going to be lenient. And also those who did not post on their Flipgrid, and either 1 or 2, those Flipgrids have been disabled and you can no longer post to those. The assignments have also been disabled on Blackboard, so you can no longer submit it. Everything has due dates. At the beginning of the course, I did say it's really, really hard to fail this course. I'm really lenient. However, you guys are adults. I'm not going to babysit you. I'm not going to be giving you all kinds of second chances. I know that this past week has been kind of crazy. Beginning on the weekend, you know, Thursday we kind of got kicked out of class because we were there and they wanted us to get home safely. But we haven't had any power outages since last Thursday. The power outages are very recent, and you've had a full week to at least get that done. So no excuses. I'm sorry, those are going to be zeros. Now, we are going to start the collection equipment and additives. We are in chapter 7. We will go back to chapter 3 here soon, but I want to make sure that we are working on this part as well because this is important. This is what you do. So without further ado, let's go ahead and go through and see what exactly it is that you're supposed to be learning about this chapter. Okay. Objectives on the first slide is you're going to need to describe and explain the purpose of the equipment and supplies needed to collect blood specimens by venipuncture and define associated terms. You're also going to need to list and describe the ETS and syringe system components and explain how each system works and tell how to determine which system and components to use. Okay. You're also going to need to demonstrate the knowledge of the types of blood collection additives, identify the chemical composition of the specific additives with each type, and describe how each additive works. You need to know what sodium citrate does, not just that it goes to the coag and that it's anticoagulant. You need to know exactly how it works. That way you can take care of it. Be more thorough whenever you're working with this so that then you don't mishandle it or anything like that. So you're also going to need to describe the ETS tube stopper color coding used to identify the presence or absence of additive, connect additives and stopper colors with laboratory departments and tests, and list the order of draw and explain its importance. Now, there are more than 1 orders of draw. Whenever I went to school, I learned that there are 2 or 3 different methods to this based on the method of collection that you are using. However, I think in this book, there's only one correct order of draw, and that's the way you should go by. However, if you want to follow my heed and do exactly what we've been doing with the hypodermic and making sure that your EDTA tubes are filled first, then you can do that as well. But of course, if they do test you, whenever you're getting your certification, they are going to be asking the order of draw based on what the book is telling you, not what I'm telling you. Kind of what I'm telling you, but not really. Okay. So I'm going to be drinking coffee because this is the 3rd time I have recorded this lecture and my voice is dry and tired and no, I'm going to need something to sip on. Plus it's cold. So next slide. Let's go ahead and start with the collection equipment and supplies. Okay. Whenever you're working in the lab, if it's an outpatient lab like LabCorp or CPL or anything like that, or even in the hospital, we have phlebotomy rooms where the outpatients can come in and get their lab work done. So these are considered drawing stations. If you go and you, some are more private than others, some are larger, smaller. If you go and donate blood, then if you notice, you're going to walk into a room and it's just going to be a big room, and you're going to have a bed and they're going to have their carts and everything situated, and sometimes there's more than one patient in there. That's okay. They're not giving out any type of patient health information. It's not really medically necessary to separate patients, but when you're in the lab and you're in the hospital, you are going to be separated, okay, just for their privacy, for the PHI and HIPAA and all of that. Alrighty. Now, your drawing station should have everything that you need to perform your job. It's going to have all of your supplies. It's going to have a table for you to work on. It might have your computer and your printer for your labels. It will have your chair, your sharps containers, your gloves, everything. So that then you are completely prepared to take care of that patient or that client while they are in that area. You don't have to be going around the lab back and forth trying to find what you need. Okay. This first slide wants to talk about your phlebotomy chairs. I don't know why it's so important. They're pretty self-explanatory, but what the phlebotomy chairs are special chairs that are made and help in the phlebotomy process. So they can have arms that will go farther from the patient or closer, or the chairs can get wider for like geriatric patients. They're made to make it easier. If you notice, whenever we're sitting in the classroom and you're sitting at the table or at your desks, it's a lot harder. It's not as my train of thought is not here, but it's not as easy to collect from those patients. So these chairs make it more comfortable, more, I can't think of the word. Oh well, I'm sure you know what I mean. It just makes it easier access for you. Now, if you are using a chair or something that does not made specifically for phlebotomy and doesn't have the swiveling arms, it doesn't swivel, it doesn't raise, it doesn't recline, you can put them in a regular chair and use a pillow as an armrest or use their bedside table. But sometimes you're going to go into the patient's room and they're going to be sitting on the side of the bed where they're watching TV or eating and different things like that. So you can use their bedside table for that. Now, there are different features to these chairs. Like if you see on page 184, there are some chairs that are kind of like your salon chairs whenever you're going to get your haircut done. And you can turn them and swivel them, or you can raise them and drop them. That's mostly for your comfort, okay? So that then your patients are at a good height. You're not bending over and hurting your back and getting sore or anything like that. So it's pretty cool. You also have the ones that recline. They have levers so that you can recline the patient's back. Those do have rolling wheels on the bottom so you can pull them forward, so whenever they recline, you're not restricted by the wall behind it. These chairs are necessary for patients who are doing therapeutic phlebotomy. Remember I was telling you about therapeutic phlebotomy and how some people make too many blood cells, so we have to take blood from them, okay? The techs usually do this because they have to check their blood pressure and they have to watch them to make sure they don't try to go into any type of emergency situation. But what they do is they lean these chairs back and have them relax, and it's kind of like donating blood, but the blood isn't used for donation. And they put it on there and they collect the pints of blood. It's really neat. Now these chairs are also beneficial because sometimes you have people who faint or get sick because they've been fasting all day. A lot of times the pregnant women have to come in and get their glucose testing and they have to be fasting, and after they take the big sugar water drink, then they can get nauseous and dizzy and weak and things like that. So we'll set them in their reclining chairs. They can sit back and try to relax as much as possible, because if they throw up or they get sick or anything, they faint, then the whole process has to start over and they have to come another day. If you have a patient that comes in and they say that they have histories of fainting, then you want to automatically put them in this chair and go ahead and lean them back, help them to practice their breathing, help them to relax, and then go ahead and proceed with your steps for collection. If you have somebody that's in a regular chair and one up higher, remember whenever you're collecting, you're going to have one leg between their legs. Now you don't have to stay like that the whole time if you don't want to, but if you need to learn to watch the patient to make sure that you can see if there's any types of signs that they might be fainting. You're going to see glossy eyes, pale skin, their breathing is going to change. That's why we keep on asking the patients if they're okay as we collect them. So make sure you prepare. They could always slide right out and you do not want any of that. So let's go to the next slide. Next slide. Who does not know what our trays are? Okay. Now there are different types of trays. We are going to have our handheld trays, just like the ones that we have in our classroom. And we're also going to have our phlebotomy carts. I like the handheld trays more because I can zoom in and out of rooms and not have to worry about anything. However, the carts are beneficial in the larger hospitals because you can have larger amounts of supplies readily available to you. Right here it says keeping carts and trays adequately stocked with supplies is an important duty of the phlebotomist. You don't want to have your tray so overused that it is running out of supplies, okay? You could have some type of a disaster, go away. You can have some type of a disaster going on, a trauma out in the field, a tornado, an earthquake, any kind of thing can happen at any time. So you have to be prepared. That's why I'm like, always keep an eye on your tray. Always keep it full. Always make sure that everything that you need for any type of situation is going to be in the tray. The only thing that I do not keep on the tray are the blood culture bottles, because those in any type of emergency are not generally what the people are going to need, what the doctors are going to order. Those are for sick patients who come in and have possibility of having severe infections and are septic. So everything, my hypodermic needles, my butterflies, my gauze, my alcohol, my tubes, everything is always stocked. I'm always prepared for war. Okay, so always make sure to keep up with that. Let's see. Now, other equipment that you're going to use daily and with every patient is going to be your gloves. Their gloves are required whenever you're touching patients, and especially now with COVID, everything has started to be a lot more, well, I don't know how to say that either. It's been a lot more important for you guys to take care of yourselves whenever you're in the patient's rooms, okay? It's very, very necessary to know and to understand that gloves must be worn whenever you go into the patient room and before you touch any of their personal stuff, before you touch any equipment, before you touch the patient, anything, you have to be wearing gloves. Okay, there are gloves that are going to be provided to you in the rooms. So nurses come in and out all the time. They have to have gloves readily accessible. So they have them in the rooms. Plus, you don't want to be walking in with a pair of gloves that you've had in your pocket or anything else. that these patients do not know where these gloves are coming from. They want to see that they're fresh gloves coming out and that you are using that. Okay. Now, I'm going to retract a little bit because sometimes I do keep gloves in my pocket, because sometimes whenever you go into the bedrooms and different things, your size gloves are going to be out, and I refuse to wear a size glove that does not fit me. Okay, the size of your gloves, it matters. If you guys didn't notice, Abraham and some of you girls, before we had got the small gloves in, were having issues with putting on your tourniquet. This is a big deal. Whenever you have your gloves way too loose and they're falling off, they can get snagged. You can dip them in blood or different things. It just gets a lot messier whenever you can't control where your glove is and if it's like hanging off a wango. So good fit is essential. My good fit, I wear small gloves. Medium gloves are a little too big for me. They are a little long in the finger. And whenever I use them and you're palpating using bigger gloves, you can feel the fold underneath, and you got to pull it all the way up to your finger, but then it'll just slide back off because it's not hugging it. You want them to hug your hands, but you don't want them to be so small that they are restricting any type of blood flow or preventing you from being able to palpate and feel the patient adequately. So make sure that they fit. If you go back up just a little bit where it says the different types of gloves, there are non-sterile and there are sterile. There's also disposable latex, nitrile, neoprene, polyethylene, and vinyl. I don't like the vinyl ones. They are really, really thick and really hard to feel what's going on outside of the glove. So I don't use those. I don't like them at all. The ones that I like are the nitrile. I never really used latex gloves because in the hospitals they tried to do away with them, and they would buy them a lot less because patients have reactions to the latex, and employees were having allergic reactions to the latex as well. So those, you won't use those very often, but if you do, they do make glove liners if you end up having any type of reaction. And they do barrier hand creams and stuff. I just usually put on regular lotion. Now these are the glove liners. I have seen them in the labs. I have seen some of the techs wear them because it can be really, really cold in the lab, but I have not necessarily seen them underneath anybody's gloves out in the field, out on the different floors and different things like that. So definitely cool to keep around, but if you need them because you're allergic to gloves and it's pretty severe, you might use those. I do have a phlebotomist in Andrews who is allergic to gloves, and she has to use oatmeal based gloves, and that's fine. You can buy specially made gloves if you do have a lot of reactions or you really sensitive skin. But I've also seen her collecting patients without gloves at all because the hospital runs out of oatmeal gloves or different things now. That's something that you don't ever want to do, is to collect a patient without a glove on. For one, you are putting yourself in danger to catch whatever disease or infection or anything from that patient if you're not using a glove. Plus, the gloves act as a barrier for if you were to stick yourself with a needle. It's almost like that glove kind of cleans the needle a little bit, so that then you have less blood or bacteria go in. It doesn't stop it completely. Of course, dirty is dirty, so you can't just keep stabbing yourself with your glove on and think, oh, my glove is cleaning it. That's not how it is. It just reduces. That's a small reduction, okay? I've seen a lot of people, whenever they're collecting babies, they don't use gloves because they want to make sure to fill the vein. I've also seen nurses and doctors, or not doctors, nurses and phlebotomists, where they have their glove on, but because they're palpating and they can't feel anything, they'll tear off the end of their glove. That is also bad practice. You cannot do that. It violates all kinds of codes, ethics. I want to say it's illegal. but I mean, it doesn't have anything really to do with the law. Um, it's against policies and procedures. It's against all your JCO, all of that, all your different agencies. You do not do that. Okay. Let's see. Don't do it. Even though you see people do it, don't do it. It's so scary. I always, you guys in class, I always tell you guys, if you want to die today, you can, but I don't. So monkey see, monkey do, don't do that. Okay? You can get fired and you can get sued. The other day I was talking about our cleaning supplies and how it was different, the antiseptics, your disinfectants, and your sanitizers. Okay? Now, antiseptics are going to be more like your isopropyl alcohol, your betadine, your chlorhexidine, your ChloraPrep. Alrighty, those just help prevent sepsis, which means it helps microorganisms, helps keep them from getting into your blood. Alrighty, so that's why we clean with alcohol. If there's anything on there, we want to move them out of the way so that then when we stick the needle in, they're not going to enter. Okay, 100% safety is not the way I mean, they are not 100% when it comes to cleaning anything, so you can still get infections at your IV sites, your venipuncture sites, and things like that. Already, but these are safe on skin. They're the strongest that we can use that are safe on skin and that won't cause damage. Alrighty, so let's talk about one antiseptic really quick that it's been used for many years, and they used to call it monkey's blood, but we're going to talk about iodine. They call it monkey's blood because it's kind of yellow, but iodine is something that is still used in the medical field, but it's used less and less. Alrighty, it's being used less and less because a lot of the patients have allergic reactions to it, and because they've also found that microorganisms it's not effective on microorganisms anymore. Kind of like whenever you take too many antibiotics and then your body builds an immunity to it, or the viruses, and then no longer kill them. Okay, that's why you don't want to take antibiotics for a long time or for just any old reason. But iodine, if your hospital allows you to use it on your blood cultures, then you would need to ask the patient prior to collection or prior to putting it on if they are allergic to iodine. A lot of patients don't know if they're allergic to iodine because they've never put it on them. If they're younger patients, maybe they've never been sick. Maybe nobody's ever asked them before, because it's not like common knowledge, kind of like your blood type. You don't know unless somebody's told you. So it's it's one of those things that you have to kind of find out trial and error. If they don't know if they're allergic to iodine, you're going to ask them if they can eat shellfish. Shellfish have high levels of iodine in their system. So if you cannot eat crab or lobster because it makes you sick, or you break out, or you have a hard time breathing, anything like that, then you're allergic to the iodine. Alrighty, and putting the iodine on the skin can cause a lot of complications, so you don't want to risk that. Now, whenever I talk to my patients and I'm asking them, and they're like, well, I can eat crab. It doesn't make me stop breathing. I don't have problems breathing, and I don't go into get any rashes or swelling or anything like that. I also ask them, does it upset your stomach? And the reason why I asked if it upsets your stomach is because when you're allergic to something and you ingest it or you put it on your skin, you can have different reactions. Not everything is going to make you not be able to breathe or make it to where you're going to break out in all kinds of hives. Okay, so a really good example, and what I talked to my allergy doctor about, was whenever I found out I was allergic to citrus foods, citrus fruits. I always had a problem eating ketchup because whenever I eat ketchup, it like burns my tongue. It feels like I got cuts, kind of like whenever you eat pineapple. but sometimes different citrus fruits, they upset my stomach. So I could eat oranges, but I could not drink orange juice. And for the life of me, I couldn't figure out what it was. But he said it's probably the way it was processed. So if I get orange juice, it has to be straight up fresh orange juice. It can't be anything like these big major companies made from preservatives and all that. It has to be like fresh squeezed orange juice. So whenever I would drink orange juice or eat pineapple or mango, it would either upset my stomach or I would get blisters on my mouth. Um, and they would go all the way up onto my ear, and then sometimes they would come down my chin. And if you notice on the right side of my mouth, I'm a little darker because whenever I do eat it, my right side, it ends up getting the bigger, larger blisters. I also get blisters on the inside of my mouth. And I really probably should stop eating these things even though I like it, but like lime is in pico de gallo, and who doesn't love that? So, bye, Mom. Sometimes I'd rather just eat it and suffer. However, allergies are progressive. Okay, so just because I can eat it now and all I get blisters doesn't mean if I eat it today and get a blister and then eat it tomorrow, I won't go into anaphylactic shock. So it's always going to change and it's going to progress with what you're doing. Let me pause real quick. Okay, so I had to pause because my son wanted me to start him some hot dogs really quick. So while he's doing that and twerking in the kitchen, we'll get back to what we were supposed to be doing. So antiseptics, if you're going to use iodine, make sure to ask the patient if they are allergic to the iodine. Now, we do have ChloraPrep. A lot of people have started, a lot of hospitals have started moving to ChloraPrep for their blood culture procedures. ChloraPrep is really good. It's stronger than alcohol, and people don't have as much reaction as they did with the iodine. Now, with that being said, they can still have a reaction, but these are little squeezy things. You squeeze it and it activates the, opens it and it goes, sorry, it's I have to show you guys in classroom, but you squeeze this applicator and it will fill a sponge with the antiseptic, and then you clean using it for a minimum of 15 seconds. Okay, the sponges are kind of rough, so you need to pay attention to what you're doing and not just sit there and rub away and be rough, because you're going to rub the patient's skin off. Okay, you have to be careful with that. Now, don't ask me how I know this or if it is from experience, because I'm not going to answer you. Now, ChloraPrep, whenever you are using on newborn babies, can give them chemical burns. So you do not want to use it on babies that are really small. I have seen people use them on older babies, like 3 months old, maybe a couple weeks old, but newborn babies, I was told that is a no-no because it will eat through their very delicate skin. Okay? Same thing with geriatric patients. You want to make sure that whenever you leave, they're not having any type of reaction or something. Pay attention to what you're doing. Pay attention to your patients and how they're reacting to what you're doing to them. Now, on to disinfectants. Disinfectants actually remove and kill organisms on surfaces and instruments. These are not made for you to be putting on your patients. This is going to be your bleach, your all-purpose cleaners, your sprays like that. Those are not safe on skin. You can get all kinds of chemical burns and reactions, not to mention you can, if they're inhaling the fumes, it's really bad. So those you don't want to use on skin, but those are the ones that you're going to want to clean your equipment with. You're not going to use alcohol to clean your phlebotomy cart or your phlebotomy tray. You're going to want to use disinfectants. The disinfectants that we have in our classroom, of course, you have the purple tops, those wipes, and we also have the pink spray. These you're going to want to keep extra precaution on. They do have really strong chemicals in these. And like the purple tops, if you notice, they have been known to cause cancer. So that's why I'm like, wear your gloves when you clean these. Okay. Of course, with all disinfectants, you do not want to use them directly with your skin, even when you're at home cleaning using your household agents. Please get used to wearing gloves. You don't want to be it's better to be safe than sorry. All right, they're not made for you. They're not made for your skin and mind. They're made for the surfaces and killing those bacteria and all those germs. So definitely do that. Okay, use your gloves. Now we have hand sanitizers. Hand sanitizers, if you don't already know because of COVID, they're alcohol-based foams, rinses, and gels. Okay, these are going to are good for replacing hand washing whenever your hands are not visibly dirty. Now, I thought I could move that, but I can't. Now, I have a love-hate relationship with a lot of things in phlebotomy only because I'm very picky. I'm a stickler, and I like things a certain way. That is how I was trained. And being trained on a naval base with a bunch of Marines, a bunch of Marine wives, we're hard asses. And so whenever we get something done, we're more OCD about things because that is what is ingrained in us, even as wives. So whenever I use hand sanitizers, those are good if you haven't touched the patient, if you're walking into a patient's rooms and your hands have already been cleaned, just to make sure to sanitize them before you start working with the patient, things like that. So they're not okay whenever you have accidentally touched urine, accidentally directly touched poop, if you were handling specimens without gloves, different things like that. Those are hand sanitizers are not okay for when you're doing that. Now, you have to keep in mind whenever you're using these products and you're using gloves, sometimes we get into the routine of things and we get comfortable with what we're doing and we think, okay, well, let me use a hand sanitizer so that I can clean my hands and then I'm going to eat this cookie. Okay. Whatever that hand sanitizer did not kill, you just put it on the cookie, you just put it in your mouth. How gross. Okay. Now, what I would say is if you are at home and you want to do a little experiment, go in there and get some chocolate and put some chocolate on your hands. Just put a drop of chocolate. Go and get hand sanitizer and then clean with your hand sanitizer and tell me if it comes off. It is not going to come off like I suspect. Maybe I should do that. It was a good analogy though. Maybe I should go and see. I don't think it would come off. I think you're just going to be pushing around the sugar, just pushing around the chocolate, and your hands are still going to be dirty. So okay, whenever you're with the patient, the way you use this is before you walk into the patient's room, you're going to get your foam and you're going to be talking to your patient and introducing yourself, and you're going to be using that hand sanitizer all over your hands. Okay, you're going to do everything that you need to do in that room to fulfill your job duties, and then you're going to either wash your hands or you're going to alcohol foam on the way out. The patient needs to see you collect the alcohol foam, and the nurses on the other side of that door need to see that you are using the foam. Medical center nurses and medical staff are informed to, if they see anybody come out of the room and they do not have alcohol on their hands, to report it to the supervisors. Okay, so it's not like you can walk out and be almost done with your foam. They have to physically, literally see the foam on your hands and you spreading it everywhere. If you walk out of the room and it's already dry, there's more alcohol foam beside the door, so you would get more. Okay, you want to foam in between every 2 patients if your hands are clean. But you don't want to alcohol foam with any more than 2 or 3 patients. You want to make sure to, after your 2nd or 3rd patient, physically wash your hands with soap and water. And there's a bunch of different reasons why, but the one thing that really gets me is your gloves are not going to go on very easily if you're not washing your hands. And I'm sure that a lot of you have noticed this in class. Each time you get to a new student for a new stick, your gloves are having a harder time. Your hands are more sticky. It's like they're more moist. There's just a coating on there that prevents them from going on correctly. So after every 2 patients, I will physically wash my hands with soap and water and then dry them off, and then I can put my gloves on easily. It does take a little bit of time for your hands to dry off. Your gloves won't go on whenever they're wet, but that's whenever you go ahead and start getting your supplies ready or identifying the patient or make small talk just to get your hands a little bit more dry so that your gloves go on more easily. Okay, remember we only have a specific amount of time with each patient, but we're not in such a hurry that we can't take care of ourselves and take care of them to the best of our abilities. Okay, so pretty cool. Let's go ahead and go to the next slides. There's your hand sanitizers. Of course, you have your bottles, and you can keep a small bottle of hand sanitizer on your tray. Most phlebotomists like to have this because sometimes when you go into the room, the foams and the sanitizers on the walls are not going to be full. Okay, the aide didn't get around to it, she's busy, or housekeeping didn't redo it, but you will still have what you need available if you keep it on your tray. Remember, I told you I'm ready for war. I'm ready for any kind of trauma, natural disaster. So alcohol is going to be on the tray. Some hospitals require it or some labs require it and some do not. I know that whenever I had worked in Andrews my first time, the first several years that I was there, and they were required on the trays. It was just understood it was on the tray. It was something that was going to be there, okay, just like your pen and your gauze. But whenever I worked at the hospital this last time, there was not any hand sanitizer on there. So I would put it on and my coworker would take it off, and I would put it on and my coworker would take it off. I think she just really wanted to spite me. I don't know what it was, but if you're having issues like that, just keep your hand sanitizer in your pocket or keep it on your tray that you're using that day, and then take it off so that then you don't have any problems with your coworkers or whatever. Like, I don't know why it would be a big deal. It doesn't make it any heavier, and I'm providing a service, making it safer for you. I don't know. It's a lot of craziness that goes on. Okay. It says decontamination of hands after glove removal is essential. Any type of glove may contain defects, and some studies suggest that vinyl gloves may not provide an adequate barrier to viruses. Remember, viruses are very, very small, and gloves are porous. So that means that they have little small openings that things can get in. Now, they're extremely small, so water droplets and things can't get in. So like you're not going to touch your patient and your hand is going to be wet for whatever reason, or blood is not going to get through there, at least not enough to visually see it. So they're just working as a barrier, but not a 100% guarantee. Okay, so definitely, even after you take off your gloves, yes, you went in there, you put your gloves on, you didn't touch anything without your gloves, you finished your work, you're ready to go, you clean up your mess, you threw your gloves, and then you have to wash again. Even though your skin did not come into contact with anything directly, you still have to wash your hands, okay? Plus, your hands have been sweaty in there. Nasty. You want to make sure to get your sweat off of your hands as well. Next. Here we go. Now we're talking about gauze pads. Now there are different sizes of gauze pads. Right now we have the 2-inch, I believe, and they are folded into 4. So like they're folded twice. If you ever look at them, you can actually open them and get them bigger. But what they do is that you can hold pressure over the site during that following blood collection. Some of them have fluid-proof backing. If you've ever seen those and you've gone to buy any type of gauze or pads, in the emergency kits, they'll have like a little plastic shiny coating. That is so that when you put it on there, the blood does not seep through. Okay. You definitely don't want to use any type of cotton balls. They tend to stick. They're just small fibers that are all put together and balled up, and so those fibers can get embedded in any type of scabbing or dried blood, and they can rip off the scab or just make it look really unneat. I'm sure that you guys have probably tried to use like a Mexican Band-Aid where you just tape some toilet paper or a cotton ball to your cut, and then whenever you go back to take it off, it's all stuck in there. Okay. Um, so definitely don't use that. Now, I have noticed a couple of you, whenever you are doing collections and you're sticking each other, you will use the alcohol pad instead of gauze. So make sure that you have two. You're going to have your clean gauze and your dirty gauze. Alrighty. Your dirty gauze is the one that you're going to use as soon as you take the needle out of the patient. You're going to put it directly on the patient's arm to stop the bleeding. Your clean gauze, you're going to put that on afterwards, and whenever you do their bandaging, just because you don't want to send the patient home with dirty anything, and because it's more presentable. If they were to take it off, they're going to take it off. It's going to be clean gauze because you've already stopped the bleeding, and they won't have these little nasty gauzes where they leave their trash full of blood. Okay. Uh, Now, avoid using the alcohol pads because one, they have absolutely no absorption. The blood will just come straight through the alcohol pad. And then the alcohol, if the pad is still wet, will burn the patient's skin. It's an open wound, and you know that putting alcohol on an open wound is a pain in the bum. Okay. Now, the bandages you're going to use, of course, you can have your paper tape, your plastic tape, you can use your um, or Coban. Those are the colorful bands that we put around. Those are types of bandages. Alrighty. Something you're going to use every day. Which your slides, I wouldn't say that you're going to use those every day. The techs are usually the ones that prepare the slides for any type of peripheral smears and things like that. But you are going to need your pen, a watch, and your patient identification equipment. Your patient identification equipment is going to be the equipment that the hospital provides to you so that then you can properly identify the patients. And Andrews, you don't carry around a computer, you don't scan the patient's wristbands or anything like that, but I do know at ORMC they don't do that, but at Medical Center Hospital, you actually take your computer with you everywhere you go, and you can scan the patient, you scan the tubes, everything is done electronically, so it's really cool because they actually get a lot of orders all day. Whenever I worked there, there were several times that I would not sit at all, not even a 5-minute break. It was ridiculous the amount of patients that they have and the amount of orders that they're doing. Now, mind you, they have a lot of doctors who are practicing there. They're getting their experience, their internships. So to me, it kind of seemed like these doctors don't know what they're doing, and there's 5 doctors, and so then these 5 doctors would all order their own rounds of tests. Sometimes even the same things that the other doctors had already ordered. So you would have to pay attention to that. These poor patients, I'm always like, oh my God. Like I have 5 knuckleheads working on me right now, all trying to figure out what's going on. So these patients are collected quite often, very quite often. So you would actually take your computer with you because you're going to be on the floor for several hours, sometimes at a time. And you have to keep an eye on the LIS, which is your it's a computer program that you're using that has all the information in it. It's all tied in together. It's your hospital system. Um, we're going to learn what LIS is later. I cannot believe I forgot. But you're going to have to keep an eye on your screen so that if any stats come through and that are ordered for the floor that you're responsible for, you would be able to catch those on your screen. So you would, after each patient, refresh and see what is there, because you have your stats, you have your ASAPs, and you have your routines. So you have to keep track of all of those and collect them accordingly. And we will learn how to differentiate what needs to come first or how to prioritize. Okay. So that's some of the equipment you're going to need. You're always going to need a pin. And pins in the hospital disappear nonstop. If you have a good pin, do not let anybody borrow it. Do not set it down. Do not leave it on your tray. It will disappear. You will never see it again. Even the pins that you put your name on, or that you sometimes you have your clear pin, you can take it off, you can slide your name on a piece of paper, and those gone. No, the nurses, the doctors, your coworkers, you will eventually find it, and it won't even be in a department that is anywhere that you have ever been, because people pick up pins and put them in their pocket and then it's gone. Okay, so go ahead and have a couple of pins in your pocket. Of course, you can have your lab coat, and it does have that. I also had Sharpies. Sharpies are the best. There are some quick drying pins that you want to make sure to get, because a lot of the pins, they don't dry quickly, and if you touch them while they're wet, they're going to smudge. So you don't want to have a smudge label, because if anything is illegible that is important, then you would have to relabel it, or that specimen will get thrown away. So kind of crazy. Let's go to the next slide. Okay. Oh, before I forget, let's go ahead and talk about your watches. The best thing would be to get a watch that does the 24-hour time. Your military time, that is what the hospital goes by, so that then we know if something was collected at 12 o'clock in the morning or 12 o'clock at night. So definitely start learning your military time. Okay, and if you don't know how to do military time, I can teach you in class. However, it's pretty easy. Anything in the early morning from midnight is going to start with a 0. Okay, so you have 0100, or you have 0200, that's 2 in the morning, 0300, and then whenever you hit noon, you're going to go ahead and start at the 12. So you have 0100, 0200, 0300, all the way up to 1100, and then you're going to go to 12, and then whenever it turns 1 o'clock again, it's going to be 13, 2 o'clock's 14, 3 o'clock's 15, 4 o'clock's 1600. So whenever you're doing military time, you do not put any type of semicolon or colons in between the minutes and the hours. So that's something that we're going to need to learn, because everything is military time, everything. So get used to doing that. Set military time on your watch. Like right now, it is 14:30. So that means it's 2:30 in the afternoon. All right. If I was to say this patient was collected at 2:30, well, is it AM or PM? Just do military time. Okay, that's the way it is. That's the way it works. Alrighty. Oh, sorry, I kind of got off. Now we're going to start talking about venipuncture equipment. And venipuncture equipment can be found on page 189 in your book. That's where I'm going off of as well. Okay, so try to follow along. And I know that this lecture is already going to be an hour long. So what I'm going to go ahead and do is I am going to stop the recording right here. And whenever you have some time, go ahead and come back to the second video. That way you can break this up just a little bit. But second video to come. Stop. Hey, I promised that it would be a second video and that it would be broken up. And for some reason, I cannot figure out how to divide the PowerPoints to I know how to remove the PowerPoints that we're going to continue on. However, I do not want to ruin the PowerPoints and not be able to go back and do this video. So deleting them is probably not the best idea. So I am sorry if this is going to be a really long lecture. But if you, like I said, if you need to, you can pause and you can go back and you can come back as you want. Just write down the time or the slide that you're on, so that then you can go to that correct time whenever you're watching the MP4. Okay, now I almost forgot to talk about your Sharps containers and your biohazard bags. Okay, the Sharps containers are pretty self-explanatory. This is where you're going to be putting all of your used needles in after you collect the patient's blood. They do come in various sizes and shapes, and they are kept in different ways. So if you look right here, let me see if I can use this pen tool. If you look right here on this one that I just circled, now that is one that's going to hang on your wall. That is something that would be right in your drawing station, and it should be next to your chair, an arm length away, because you're not supposed to be walking around looking for somewhere to put your needle after you've used it on a patient. It's dangerous, and your risk of getting a dirty needle stick is higher. So what they like to do is to put it like right over the chair or just somewhere that you can actually reach to put it in. Uh, Preferably not reaching over the patient or whatever. The logistics, it varies depending on drawing station. So, but that is what that is for. That is because you want it easily accessible. Okay, so if we look at this small one right here, okay, this is a small one that you can actually keep on your tray. We did have small ones. I don't know if your trays have them right now. We did have small ones that we would use, and those are not for you to use all the time, but to use in situations where you go into the room and the wall sharps container is full or it's jammed because somebody didn't put their needle in properly. That is so that then you can go ahead and have a safe place for you to put your sharps whenever the one in the room is not usable. There are different sizes of these sharps containers. They can be on carts. Like the one that we have in our classroom is just on the floor. You can have your short ones or your tall ones. And you will see these in the emergency rooms. You'll see these placed in various places in the emergency rooms, and they will be open. There are some fat ones, there are some not fat ones. I mean, it just varies. So those are in there and ready to go for uh, if you need to say like there's a trauma, it's a big one so that they can put a bunch of different stuff in it. Alrighty. These sharps containers are made so that then people cannot get into them. And the things that I'm going to tell you, you're probably going to think I'm crazy, but patients and patient family members have been known to try to break into these and to get the needles so that they can use them. They sanitize them and they use them for drugs, okay, and self-mutilation and different things like that. So these have to be locked at all times. So only the people that have access to these are going to have the key to be able to change it. And they're going to put that key away so nobody can find it. Now, if you put something in that container that does not need to be in there, if you drop your wedding ring, if you drop notes, if you actually drop your pen, whatever, and it is gone for life. It is headed to the incinerator and you will never see that again. So I always suggest do not use or wear your wedding bands or anything else that's important to you, no bracelets or anything, because if you were to drop it in there, it doesn't matter how expensive it is, you are not going to get that back. You are risking all kinds of craziness if you want to dig in there and try to get that back. Plus, all the blood, all the contaminants, all that, disgusting. I wouldn't even want it back, okay? So let's see. People have also been known to want to try to steal medications out of there. The nurses do use those to drop unused pills in there. They also use them to put, like they have their little vials and they take the medication out and put in the syringe and then they inject the patient or put in their IVs. They do go in there as well. So patients, if they know like morphine or these other drugs that are really high or popular or whatever, they will go in there and try to steal those. Now, I've also heard on instances where people will go in these to collect the blood. If you haven't noticed, there are a lot of different weirdies. I don't want to call them weirdos because maybe they're not weird, they're just different. But people that are a part of different cults and different things like that, they actually use blood in sacrifices. They eat and they drink blood. They also like to wear blood. If you've ever seen anybody that's supposedly, let me come down a little bit, supposedly like a witch, follows witchcraft, Satan-y stuff. I don't know a bunch about those, but I have known that they have little vials of blood, the people that want to be vampires, okay, and they have little vials of blood, they make their jewelry out of it. So we don't want them getting into this. We don't want to be liable for anything that can happen, and we don't want them endangering anybody else or anything like that, because sometimes there's scalpels in there. Depending on what the doctor's done in the room, and we don't want them to have access to that either. Alrighty. If you see somebody trying to break into one of these, definitely call security. Alrighty. Now, on to the biohazard bags. You guys know that I have talked to you about these. They're really important. They're not something that you can just do without. You do not transport a specimen from the patient's room or from different areas of the lab without the biohazard bag. Okay, if you're going to go into any hallways, into another patient's room, if you're going to send it in the tubing system or anything like that, your specimen has to be in the bag. Okay, now this lady in the picture, she is actually wearing a glove as she's handling this bag, as you should. Okay, do not ever reach into the bag to get your specimen out without gloves. Alrighty, and the reason why I say not to do this is because the inside of that biohazard bag, it is contaminated. I've shown you guys because I've got onto you a couple of times for going and walking around with your blood without your gloves on. But if you look at the stopper in the top of the tube, you know how okay, so where am I? You have your tube, right, and your blood is down here. Well, you have your stopper where your needle goes in, just like that. Okay, if you turn that and you look into there, 99% of the time you're going to you can visibly see a little bit of blood in that stopper. Now, that blood is not always clotted whenever you're putting it into the bags, and drops of that blood, whenever you're jostling it around, you send it through a tubing system, or whenever you're dropping the tubes in there, it's splashing and it's getting everywhere. You don't want to reach your hand in there and take it out, and then you didn't see the blood that was in there, and now your hands are dirty. Okay. Also, whenever you're collecting different specimens, whenever you're collecting urine, the patients, whenever they're doing that, a lot of times they pee on their hand, or it just gets a little messy. Maybe they might spill it a little bit. Maybe they will pour it out just a little bit because they overfilled their cup. But whenever they put the lid on there, it's not like 100% good, a bona fide seal. So the urine that was on that is going to be pushed down onto the cup. If they were to not put the lid on properly, because a lot of times they don't pay attention to that, the urine could be spilling from the cup as you're going around. They bring you guys, I have seen it all. Patients will bring their urine in the cup is tipped over, there's urine all over the bag, and you're going to be opening that, and your job is to take that out of the bag. Okay. You don't want to be doing that with a naked hand. And whenever you open them, you want to open them away from you. You don't want to be looking in it and opening it, because if there is urine in that seal and you open it, it's going to splash on you. I'm not kidding. I have always practiced very safe. Opening anything is always away from you. I was taught that. That's just something that I do. Opening tubes away from me. You don't know if it's going to splash or whatever. A phlebotomist, I could not stand her. Oh my God, I love everybody. I hate to be a hater. I'm not a Karen sometimes. But at MCH, there was this girl that I had she was always so mean, and God, please forgive me, but I could not stand her. It did not matter how nice I was, how much I helped her, whatever. She was just always kind of like vindictive, or like she had this barrier that she just couldn't get over. She was like, I don't know. I always told her she was a rough Mexican. Like she was like one of those scary ladies. Like you see moms and grandmas like this where you can't even communicate with them because they're just so damn scary. You're like, I don't know what to do. I don't know I just want to cry because she's so mean. Right? Well, this girl was only 28, maybe 30, newlywed. So she was really young. So I was like, it can't be because she's an old crazy Mexican, because I know how we can be. I'm not being racist whenever I'm saying this, but sometimes us Hispanic women can be hard asses. Okay, we're hardcore. We don't take any crap from anybody, and our personalities, it shows big time. Okay, there's no in between, bubbly, nothing. We got attitude. Okay. So she was really hard to get along with, and she was working the tubing system. Every now and then, whenever you work at MCH, you would be required to work the tubing system, which means that any specimens that come up the tubing system, you're going to be responsible for receiving it into the lab and dispersing it throughout the different departments. So You're the one that kind of keeps everything coming and moving, so the techs don't have to physically stop what they're doing because they have hundreds of tests running and come in to do this. So they'll help and stuff, but still, you're the one that does that. You monitor the orders, keep your phlebotomist on track, different things like that. So she was like on this rampage kind of day. I mean, I'm just like, girl, you about to get beat up. Okay, so she goes and she's in a hurry. She's not paying attention. She doesn't notice that the urine has spilled in the bag. And even though it's sealed, you put the urine in, you seal it, the urine is spilling in. It's not 100% waterproof, that seal. So urine was leaking into the seal of that bag. So when she opened it, and she opened it fast, she was over it. Her glasses were all splashed with pee, and she even had it like splashed on her lips. She's like, I think I got it in my mouth. Like she was totally freaking out. And I could not help but love every minute of it because she was so mean. I thought that is exactly what you deserve. Now, I'm not a hateful person. I try not to be, but sometimes you're just like, you better watch yourself because God is watching and he will pay you back with karma. And she got karma most definitely. So do not open the bag under you. Put it away and open it. Okay, you want it away from you. You don't want to be hovering it. You don't want it to be tilting towards you and open it. You know, go practice this. Go practice this. Go get a Ziploc baggie and practice opening it with water or something inside. It is going to splash you. Okay, you don't want anybody's pee pee or poo poo on you. Alrighty. I've also seen where uh, patients don't really understand the instructions whenever they're collecting uh, their stool specimens, and you'll tell them how to collect it. You'll give them the cup, and whenever they come back, their poop is actually in the bag and not in the cup. Okay, so you don't know what the hell they're doing there. Did they use gloves? Did they get poop on their hands when they're trying to scoop it and then they use the poop hands to close it? Did you have urine on your gloves whenever you're preparing the specimen and then close it with the zip? There's all kinds of different things. So that bag, that whole thing, nastiness. Nasty. You don't know how dirty the nurse was, what they were touching whenever they were collecting that. Were they wiping the patients down, cleaning their bottoms, and then zip up that bag? Think about it. Think about how nasty. And then you're going to go, and like I said earlier, you're going to go and you're going to just use your little hand sanitizer, and then you're going to go and drink your coffee in the break room or eat a little piece of pan dulce. Okay? You're eating shit. This ain't the help. You do not want to eat crap pie. Alrighty? So definitely pay attention to that. Okay? I'm sorry, it's nasty. I know, but you need to know. And I'm not scared to tell you all the experiences. Okay, so let's go ahead and move to the next slide. If you guys can notice, I'm getting a little bit of energy. My coffee's like got me like, ah. So let's move before we keep on going because it's already been an hour. Let's see. Next one. Venipuncture equipment. This is the fun part where we're going to get to learn about all of the different things that we use, why we use it, and how they can benefit you if you use them properly. Alrighty. Venipuncture equipment, everybody is so excited about the vein locating devices. And I, again, have a love-hate relationship with these because you know me and I'm like, if you can't do your job, then you need to find another job. But I am very, very good at what I do. Okay, and sometimes it is impossible whenever you have the little tiny babies, the severely dehydrated patients, the patients who have history of IV drug use, the patients who are on dialysis and diabetes. All these different things can contribute to the size and the strength of these veins. So, and that affects if you can find them or not. So just because you can't find a vein, don't think that I think that you are a crappy phlebotomist or that you don't know how to do your job or anything like that. I just don't want you to start to rely on equipment like this. And the reason is that it's not always accurate and it doesn't give you all the information that you need. It doesn't give you the whole picture, okay? But let's go ahead and tell you about what this is. This is a vein locating device, and what it does is It shines a high density light into your skin, and anything that is more dense in skin, you'll be able to see it. So um, if you have veins that are full of blood, you will see them as dark lines. You can see them underneath, just like in the picture. Um, and they help you to find veins. Now, you can locate the veins this way. Sometimes they could be larger nerves, so you got to be careful, but they don't tell you how deep the vein is, how strong the vein is, the size of the vein, anything like that. Okay, now you're putting lights in. It can be shadows, it can be deeper than you expected, it can be one of them squiggly veins that are moving and you really can't anchor very well. They can be very weak-walled veins where every time you put the needle in, they collapse, or when you put the tube on the holder, they collapse. So even though you can find the vein, you're still going to need to be able to palpate and determine the quality of this vein. Okay, now there are some locating devices that are on stands. Andrews has a stand. If you ever go, ask them to see if you can see it. I'm sure Rhonda would not mind, but you can actually see this stand, and it can hover above you, and you can situate it to where it will stay on the patient and you can do your collection. Okay, but a lot of them are handheld devices. So how are you going to stick and palpate and hold this device or remember where that vein is or was if you take that light off? So it's just a reference. All it is a reference. Here's an idea. Look, there's one right here. Now it's your job to catch it. So very cool. Alrighty. Next slide. We all know what a tourniquet is, okay? It's a device that's applied or tied around a patient's arm to restrict blood flow. Tourniquets, it's more of a general name. Now, these are medical grade tourniquets. Those are used specifically to be a tourniquet, but a tourniquet can be anything. A tourniquet can be a shoelace tied around somebody's wrist who cut their finger off and they're trying to stop the blood flow. It can be a belt, it can be rope, it can be ribbon, anything that is going to be put around the appendage to stop the blood flow. Now, with that said, whenever you do put it on, it'll restrict the blood flow to the veins, but it should never restrict the arterial flow unless this patient has had severe damage to that extremity and they are bleeding out. Okay, now then maybe you'd want to restrict the flow to the artery so that they don't bleed out so fast. Alrighty. The ones that we have and like the ones that are pictured, those are cool. There are different types. There are different colors of tourniquets. You can get tourniquets like we do, and they're all individual. The one in the picture right here is a wrap. Okay, so it's a roll, so then you just pull it out with your tourniquet and pop it off whenever you need it. Not all tourniquets are created equal. Some are more stretchy than others, some are thicker, some are they grab your skin and pull your hair a lot more. It seems to be like the cheaper the tourniquet is, the less friendly it is. My favorite are the orange ones, and they come in little rolls. I like to roll my tourniquets and keep them in a drawer underneath my thing so that then if I come to a patient's room that has something that could be contagious, or if I look at the patient and they're visibly dirty or they don't look like they have very good hygiene, I want to have extra tourniquets on my tray so that then I don't take that dirty tourniquet and use it on another patient. So I do that. They are disposable. I go through a lot of them. If they're in the hospital and they're sick, you don't know what's going on, you don't want to be transmitting any of that. Now with COVID, it's probably something that has been put in place to where you will not reuse any of your tourniquets at all. So definitely go by what your hospital says. If you only have one tourniquet and you have no choice because there is nothing else, then you can actually disinfect and sanitize these with your purple rags, with your purple tops, and then hand sanitizer, whatever. Just make sure that it dries before you put it on the patient. Let's see. Oh, they also have tourniquets that are straps, so they're set on Velcro, so they're reusable ones that would be used more of a setting of blood donations and outpatient labs, but it's just a Velcro and you put it kind of like a cinch belt and you just tie it and you take it off and then you can use that. Now they can be sanitized and washed, so that's pretty cool. Needles, yay! Now, needles, of course, there are different types of needles. You have your multi-sample, your hypodermic, and your butterfly. The needles are sterile, they are disposable, and they are designed for single use only. Okay, if you were to come up to a needle on your tray and the seal is broken, you know, on your multi-sample needles you twist it and the seal is broken, that is no longer sterile. You cannot put it on your tray and go everywhere and then come back and use that needle on somebody else. So you can't pre-prep your needles and your adapters for your morning draws or anything like that. I did see phlebotomists do that, and I'm thinking y'all are so wrong, but to each their own. Now, um, with that said, there's a different parts of the needle. You're going to have your bevel, you're going to have your shaft, your threaded hub, and your rubber sleeve. Remember whenever I showed you the needle and we pulled back that rubber sleeve? Okay, that is what that is. Now your needle gauge is different. Now you know in your vein, whenever you're learning that, the opening, the inside is your lumen. The gauge is based on the size of the lumen, the size of the hole on the inside. Alrighty. The higher the gauge, the smaller the diameter of the needle. That means like the bigger the number, the smaller the needle. 23 is smaller than a 22. 22 is smaller than a 21. A 21 is smaller than an 18. Okay. Needles are color coded, so just like the tubes, whenever you're color coding, you want to make sure to learn the color coding system. So if you were to be right here, a 22 is always black. Okay. A 21 is bigger, but it's always green. The 23 gauges that we use for our babies and for more delicate patients is always going to be smaller, but it's a bigger number. Okay, now the 18 gauges, those are always the pink, and I'm going to do that in red right here, but those are always pink. Okay, so these are bigger to smaller. Alrighty. Now these needles, they do come in the different lumen sizes. However, they also come in different lengths, and this is something that I have been trying to teach you guys for a while now. Whenever you're not able to gauge how far your needle is in your arm, you need to get a visual memory of how big an inch is. So get you a ruler, and I know that my finger right here is about an inch. So just looking at that, I can tell it's an inch. If you were to show me something else, I would know that that is an inch. Like this is more than an inch. Okay, this is a little less than an inch. So if I remember that this is less than an inch just based on what my finger is, I can look at this and know it's less than an inch. I can look at this and know that it's an inch. Okay, I can look at this and know that it's an inch. Alrighty, so whenever I'm looking at my needle and I'm trying to decide how deep my needle is in, I'm looking to see how much of that inch is missing. Okay, so if I know that all I can see is this much of an inch, then I know that my needle is in that far. If I can only see this much of my needle, then I know that my needle is in this far. Okay, I don't know how else to teach you guys that, but memorize the size of your needles. Get a visual memory so that whenever you're like, I don't know if I'm too deep, and then you're like, okay, well, I'm going to back up, and then you take the needle out. Well, it's because you didn't remember how long your needle was, so really you didn't know how far you were in. Okay. Also, before you make any movements, before you do anything at all, palpate very lightly to see where your needle is. Okay, you can feel the needle underneath the skin. It's going to be hard. It's not going to be bouncy. You don't want to push on it because when you push on it, you're just slicing the patient. But that is also another way. Before you move forward or before you move back, you can judge how far in your needle is. Now, I do like the 1-inch needles. I've never had to go, well, I'm not going to lie. I have had to go pretty deep with the 1.5-inch needle on a geriatric patient. But not very often, because just because they're not geriatrics, I mean obese patients. I'm always saying geriatric, but obese patients. Just because they're bigger and just because their arms are abnormally large doesn't automatically mean that their veins are way down deep in there. Okay, now the fat can be accumulating and the muscle can be accumulating under the vein, or it can be accumulating on top of the vein. It just depends on how their body is processing that. Now, generally speaking, it's usually underneath the vein. So don't think that just because you have a larger patient, you're going to need a needle this big to get to a vein that is that deep. Okay, so palpating and feeling how deep that vein is and knowing how far you're having to push your finger in from the surface and the surface tension is how you're going to decide what length needle you are going to need and how far you're going to have to put that needle in. It's all guesstimating, and it makes me so mad all the time because people don't really understand how phlebotomy works. And yes, we are good at our jobs and we are trained to find those veins, but we do not have x-ray vision. Everything that we do is based on an educated guess. We know where the veins are supposed to be. We know how they're supposed to feel, but we don't know 100% that that is a vein or that it isn't somewhere else, or how deep it is, or if it's going to move to the side when we poke it to the needle. We don't know any of that. Okay, we know a lot based on our experience and the training that we've had, but patients seem to forget that we are not Superman. We do not have x-ray vision. Thus, we don't know what is in there. We can't see through. You're not see-through. Okay, people are not see-through, and then they get really mad whenever you miss or different things like that. But keep in mind, we're human. Okay, humans do make mistakes. But before I get on my soapbox, I better get to the next slide because I'm sure you guys understand that, and you're going to understand that more whenever you start working. Okay, same with your nurses. They don't have x-ray vision, guys, so don't get so pissy when they miss. Let's see, next slide. Now, some venipuncture equipment does come with safety devices. Ooh, what happened? What did I do? What did I do? Okay, I'm back. Sorry, I do not know what I did. Okay, so laser pointer. Some devices, some supplies are going to come with safe devices. Now, this is a safety device that comes on the adapter, on the hub, and this is a safety device that comes with your needle. I'm pretty sure you've seen them both, but if you have not seen them, let me know and I'll show you in the classroom. Okay. The evacuated tubing system is a closed system which blood flows through the needle insert into a vein and then directly into the collection tube. It prevents exposure to air or outside contaminants, and it allows numerous tubes to be collected with a single venipuncture. Okay. These, whenever using this, the ETS system, you're going to be using a multi-sample needle, tube holders, a needle and holder units, and evacuated tubes. Okay. Now, the safety needle and the traditional hub, if you look right here, here is the tube holder. Okay, this one does not come with the safety device. The safety device is going to be on the needle. The needle is going to twist into the adapter, into the hub, and then it's going to hold your tube for you while you're doing the collection. Okay. If you look right here, this needle has the sleeve around it, but whenever you put it into the tube, the sleeve is automatically retracted so that then the blood can flow into the tube. Let's see. Oh, For some reason, I didn't think that it changed. Did it? Yes, I think it did. Okay. So this one right here is a traditional needle and safety tube holder. Our tubes come with the orange one, but the same thing already. It's going to come with a safety device on the hub. The needle is inserted into the adapter the same way, and it works the same way whenever you put your tube in. The shaft is going to be, not the shaft, this is the shaft, but the rubber sleeve is going to be pushed up while the tube is on the adapter. Multi-sample needles allow multiple tubes to be collected in a single venipuncture. They are double pointed and have a threaded part that screws into the holder, that's your centerpiece. And then a tube end of the needle is retractable sleeve to prevent leakage. They also say that this helps to clean any type of additive for kind of off of the needle so that then it's not going into the next tube. So that's pretty neat. Okay. The multi-sample needles are available with and without the safety features, if you didn't see on the previous slide. So if you are going to have a needle that has the safety feature, then you need the adapter or the tube holder that does not have the safety feature. If you have the adapter that has the safety feature, you need the needle that does not have it. You cannot have double the safety feature on these things. So, so that's how you're going to use those tube holders. Needle and holder units. The needle and holder is permanently attached. Now, there are some instances where you can order the needle and the hub connected together. They're permanently attached. You don't have to screw them in or anything like that. You just open your packaging. It is ready to go. Alrighty. Your evacuated tubes, they do have, you can use them with both the syringe and with your ETS. So you don't have to worry about having to get different tubes or specialized tubes. They work with both because the needle's still going to go in it. Okay. They're available in different sizes and volumes. Your tubes, if you haven't noticed, you have your tall tubes and your short tubes. I'm always talking about those. So your short tubes are going to be like your 3 ml, your 4 ml, and even smaller. And then your taller tubes are going to have the like the 5 and 6 ml, sometimes 7. And you even have these fat tubes that we have in the classroom, and I think they have like 10 ml. We'll have to look at them and see, but you can get them pretty big. Okay. Now, the size used generally depends on the patient, and what this means is that you will not fill full-size tubes with every patient. And the age plays a big factor in this because some patients, say like babies, cannot donate that much blood. It's really hard for you to get more than 5 mLs from a newborn baby. So you would use these small microtainers. The baby tubes that I've been teaching you try to kind of use. So that's going to play a factor, as well as if they're hard stick, any adults that are really hard stick, if they are severely anemic, anything like that, you don't want to increase their anemia. So you're going to make sure to pay attention to that. Also, on your evacuated tubes, if you look, if you just need a little bit of serum or a little bit of patient plasma or a little bit of whole blood, then you won't need these big, huge tubes. But that's always just last resort because they might add on tests. If they add on tests, then you're going to have to recollect the patient. So it's always better to get more. So we'll talk about that more in class. Now, the size and condition, so the volume of the blood needed for tests, you need to pay attention to that. You need to know the minimums that your lab requires. Alrighty, but more importantly, the size and condition of the patient's vein. If you have a patient that is severely dehydrated, their veins are very weak, or they're very small veins, say like your hand veins, you might not want to put that ETS directly to the vein because that suction of the tube can be too much. It will suck in. Have you ever tried to drink a shake and the shake was so thick that whenever you're trying to slurp, and I didn't mean to make that sound, but whenever you're trying to slurp so hard, you can't get anything ice cream in there, and then the straw just collapses. That is the same thing with your veins. And remember that vasoconstriction, it will open back up, but it is harder to get blood out of a closed vein, and sometimes they do end up just going on ahead and starting to bruise and blood leaking out, different things like that. So the size and the condition definitely is a determining factor on if you're going to use a big needle, a small needle, if you're going to use the butterfly or the hypodermic. And they do sell the multi-sample needles that are 23s, but you still might not want to use that 23 on delicate veins and put the ETS, your tubes on there, because that suction is still a lot. Plus, the smaller the needle, the more damage to the blood cells it causes, which is called hemolysis. Okay, so you don't want to hemolyze the blood, so you want to make sure that the rate that it's going to be going into the tubes is also going to be safe. Okay, let's see. Needle and holder units. Okay, so the tubes actually have a vacuum in them. And if you don't know what a vacuum is negative pressure that is put into the tubes that is sucking. It needs air. It's going to suck in anything. It's creating a vacuum. So whenever you put the tube on there, the blood is not just flowing into the tube. It is actually needing to bring it in. Okay, it's designed to do that, and it's designed to accept a specific amount of blood so that then the ratios to the additive are correct. The ratio for the blood to additive is correct, and also to make sure that the tube is filled to its capacity. So the larger tubes will have more vacuum than the smaller tubes because they need more blood. Okay. Some tubes have additives like your anticoagulants. Those are going to be your plasma tubes. Those can be either whole blood. If it's not spun, it's whole blood. We've already discussed this. If it's not spun, it's whole blood. But on your additive tubes, if it is spun, then the liquid portion at the top, the generally clear yellow, it's lacking all of the cells, is going to be called plasma. Okay, so if it has an additive, then you're going to have plasma. If there's no additive, or if it has like a clot activator, then whenever you spin it, you won't have whole blood on those because the blood is going to clot. The other ones keep them from clotting. So it's going to clot, and you're going to get your serum out of that. Alrighty, so you cannot have whole blood in a non-additive or a clot activator, only with the plasma tubes. The stoppers on the top are made out of rubber, and they have the plastic covering that keeps those, and that's the lid to the tube. The rubber makes it easy for the needles to go in so that then you can fill the tubes. All the tubes do have a color coding system. We've already talked about this. And so the additives in the tubes are indicative of the color of the tube, okay? A sodium citrate, a light blue will always have sodium citrate. The light green will always have lithium heparin. Okay, now there are some exceptions like I told you on those ones. So dark green is sodium heparin, light green is lithium heparin. Okay, so definitely try to remember that. Color coding. Let's see, here are your evacuated tubes. That means that they have the vacuum. Okay. A needle holder and units. Now the syringe system, this is what we have been using. This is where you put your syringe onto a hypodermic needle, and that's how you collect the blood, by actually pulling it. Alrighty. Now, this is the traditional components. The needle is going to come separate, and it's going to have a safety device for you to be able to close it. The syringe is graduated, so it's going to have your marks for your millimeters and your or your cc's. We no longer use cc's in the medical field, but if you know it by that, these are each 1 cc, 2 cc, 3 cc. So if I say you're gonna get me a 10 cc syringe, I'm really saying milliliter, sorry, mLs. Okay. Whenever you put this on, you're going to twist it on. Now this is the plunger. Whenever I say to pull on the plunger, this is what I'm saying to pull back on, okay? Whenever I'm like, okay, well, you need to pull back to see if you're in, don't pull the needle back. You're going to pull back the plunger. The plunger is going to create the suction. The tubes have suction in there because they're vacuum. They have a vacuum in them, but the syringes do not. Okay, so you're going to actually have to create that suction and take the blood out of the arm manually. Whenever you're done with it, then you are going to close the safety device. Now, there are, if you notice right here, she has an adapter. It is a safety adapter that we have in our classroom. Not all of the hospitals or not all of the labs are going to have these, so you would use a transfer device, which is an 18 gauge needle. But what this does is it helps you to fill the tubes without putting yourself at risk of sticking. Okay, I did show you how to, if you're using the transfer needle, how to properly put it in, not holding the tube, not holding your naked tube, empty tube. You're going to put it on the tray, you're going to pick it up, take it off, put it in the next tube, take it off, put it in the next tube. That way you're not holding it because you can stab yourself, okay, if those aren't available. Let's see. Blood collection sets, these are going to be your butterflies, or your winged infusion sets. So they're, they call them butterflies because they have little wings on the side. The wings are for, to keep it sturdy if you have to let go. Now, let's see. They are made for hands and elderly and pediatric patients, not your healthy patients with big old jumbo veins who just want a butterfly. And I know I'm not supposed to, and I don't suggest that you do this. Don't do what I do. But if a patient asks for a butterfly and they have these huge, amazing veins, I will give them a butterfly, but they are going to get a 21 gauge needle. Okay, they will get a 21 gauge butterfly. Patients are more adept to accepting a butterfly just because of its wings. They don't understand that the needles that we use without are the same size. So it's, and they don't know the color coding systems a lot of times. Of course, a nurse or a doctor might throw a bit more of a fit, but I don't generally use butterflies on big, strong, healthy adults that have great veins. It's unnecessary. It's a waste of money to me, and it's a waste of resources because I need those for my babies. My babies need to get taken care of. To me, I feel like they can grow up and get over themselves, but if they do ask for a butterfly, you are required to do a butterfly. But if they do not say a 23 gauge butterfly, then I would use a 21. Okay. Now, like I said, don't do what I do. There are blood collection sets that are non-wing. I don't think I've ever seen any of those, but pretty cool. Now, this is a butterfly. Okay, and I'm sorry I cannot move this, but this picture can be found on page 201 in your book. Okay, so you have winged infusion sets that can be attached to a syringe, and the other ones that can be attached to a hub, an adapter. Okay, so these infusion sets are going to come, if you notice, they're going to come with a needle. The needle is going to be attached. If you're going to use the ETS and you're going to attach it and just let the tubes fill on their own, then you would put your adapter and you just leave it as is. But if you need to put a syringe because you're collecting a baby or very delicate small veins, then you could connect it to a syringe so that you can control the pressure that you're asserting to these veins. So you would take the needle off, it just pops off, put it directly into your sharps container or into the butterfly little tray that you took the butterfly out, so that you can keep your sharps visible and know where they're at. And then you would put your syringe on there, and they work just like you're just going to pull the plunger and it's going to pull the blood. We're going to learn those here soon, so work on that. Now, there are combination systems. A complete system for blood collection tubes, and collection apparatus are combined in a single unit. The specimen can be collected by ETS or syringe and is available with regular butterfly style needles. Safety devices are available. Okay, let's see. This is the needle and holder unit. What in the world? Okay, so I have never seen these. But what this is it has the tube on the device, and it's just your needle and your tube. Okay, this is a Monovet venous blood collection system. It looks like it just goes into the tube directly, and that you don't change out the tubes. Okay. Anticoagulants. So we're going to talk about anticoagulants, but let's go ahead and take another little break while I go and get something to drink and check on my Sunny. Okay, so I took a little break and I kind of decided that I don't want to give you this whole lecture. There's still like another 6 pages that we're going to go through, and I want to make sure to go over each of these additives a little bit more in depth. So what I'm going to do is I'm going to go ahead and stop the video, and this is going to be yesterday's lecture, and then on Thursday, if we have class, then I'll give you the rest of the lecture. But come Thursday morning, if they decide that we are not going to open because of the weather, then I will record another lecture for Thursday. And this will give me time for me to go ahead and add some assignments to the Blackboard for you so that then you can work on those. Because I really want you to get some of these assignments done as well. I don't have my workbook, so what it's going to come from is my learning resources or from the chapter questions over here. But most definitely one of your assignments that is required is going to be your Flipgrid. Don't not do it, okay? All those zeros can really add up. You can download the app and you can even do these from Safari and from Chrome. So you can do it on your, oh, I thought somebody was coming. I thought, who the hell is that? But you can do it from your laptop, your computer, your iPad, your phone. So no excuses, okay? Really, there's not any excuses for you not to do this. Aside from that, if you have any questions or you want to go over any of this, then let me know. I know some of you can't watch these lectures without getting sidetracked. I understand. I'm sidetracked myself. I hate doing these lectures online. But if you guys, we really don't have any other choice. We need to continue to move forward because we don't want to get too far behind. So take your time watching this video again if you want to. Also, the PowerPoints are going to be added to this Chapter 7 folder so that then you can go through and follow along as you read the book. So we're going to stop on page 203 in your book. Don't go any farther than that unless you just want to read ahead. But next lecture is going to start on page 204. Okay? Let me know if you need anything. Y'all guys stay safe and warm.